Dr. Barris, did you get your access to the syncing?
Yes, I did. You know,
Oh,
it's just
good.
amazing if you have IT on the line, everything works fine. Did the same thing I did before, and this time it worked. So
Funny how it always happens that way.
yep. Yeah. Thank you though.
Mhm.
As long as we're talking about IT stuff,
Uh-huh.
this is Cindy. I keep getting a message on the iPad that it needs to be connected to either update or save or something.
I just emailed you, Cindy. Are you on right now through the iPad, or did you go on through a different device?
I'm on the iPad.
You are. You did manage to get on through the iPad.
Yes, I did. When I clicked it on the agenda, no, in the letter, it didn't work. But when I went in through the last amended agenda I received, then I got in.
Okay. So just to make everyone aware, I guess, I through working with Debbie and MIS, there have been several board members throughout the county, not just this committee, who are running into some errors on their iPads. All of a sudden something will happen and where Zoom is no longer working and they actually have to physically bring their iPad in for MS to do some sort of update. So if something happens where all of a sudden your Zoom is no longer working on your iPad, then let us know, and MIS will obviously let MIS know what the issue is that you're experiencing, and then they'll be able to tell us if it's something that they can fix, obviously over the phone or virtually, or if it's something that you'll have to bring it in for. Debbie, unfortunately, is experiencing something that she's going to have to actually bring her iPad in for. So she fortunately was able to get in on a different device today. But so just to give you guys a heads up that it's not just one person, multiple people are experiencing some issues. So.
Didn't see those last night, not like that anyway.
Hi. So my iPad is completely dead. Somehow it died over the night when it was at 100% yesterday. So I'm trying to get my iPad fired up.
Does it look like we're still waiting for one more board member? Am I counting right? I think I counted 6, but
I believe Bradley Wagner.
thank you. Could not think of who we might be missing.
All right. I don't think Brad's going to join us. If he can just join later. I'm going to go ahead and get this meeting started. So Was our agenda properly posted?
Yes, it was.
Wonderful. Then I would entertain a motion to approve our amended 20-point agenda.
I so move.
Motion by Cindy Chicker. Is there a second? Debbie Kaiser seconds. Is there any discussion? Hearing none, all those in favor signify by saying aye.
Aye.
Aye. Opposed?
Aye.
Opposed? Motion carried. Are there any questions, comments, or concerns or amended stuff on the agenda or the, the minutes of the November 12th meeting? Additions or corrections? So hearing none, I would declare that those would be approved. Moving on to agenda item number 3, citizen comments. Are there any citizen comments? Are there any citizen comments? Hearing none, we'll move on to agenda item number 4, the director's report.
Thank you. All right. Well, as you probably recall, early in November, Governor Evers issued an executive order advising Wisconsinites to stay home and encouraging businesses to take additional steps to protect workers, customers, and the surrounding community. So that same week, following our last month's Health and Human Services board meeting, our management team met to review our agency safety measures. And after consultation with our health officer, the management team, and the county administrator, we did decide that we should close the community services building to the public once again due to the significant increase in the cases, the COVID cases in the community. So we closed at the end of the day on Friday, November 13th. I expect that we will remain closed at least into the beginning of the new year, but we will continuously assess when it's safe to open the building again. Services are being provided by virtual means using video conferencing, phone contact as much as possible, with in-person services being provided only when necessary. All of the staff meetings are being held via video conferencing. Our staff continue to work both remotely and in the office. 3/4 of the Health and Human Services staff are working remotely, either full-time or part-time. Since our last board meeting, fortunately, none of our staff have needed to be in isolation because of testing positive for COVID. None have had to quarantine due to an exposure, and only 2 staff have had to miss work while awaiting testing results. Now, I know that Rose will talk more about the status of the pandemic, but I'd like to share how public health is managing our staffing for the significant workload needs during the pandemic. I'm sure I've said this before, but it is important to emphasize that there's no way that a small public health unit like ours could possibly manage this response to the pandemic for the whole county without a lot of additional help. Our 3 public health nurses, including Rose, are putting in substantial number of hours each week to meet the demands of managing this emergency. In addition to their regular 40-hour work week, they are also working evenings and weekends, and even that is not enough for the work that needs to be done. Since the summer, we hired limited term lease staff and reassigned duties of some of our other existing staff. 12 of our Health and Human Services staff from other units are putting in extra time and taking on extra duties to conduct contact tracing, help with testing sites, and support emergency operations center activities while also keeping up with all of their regular duties. We currently have 3 limited term lease staff working in public health, and we are seeking an additional nurse due to the increase in cases and in anticipation of the upcoming vaccination program that we'll need to be a part of. We've been able to fund this extra staff time with the federal CARES funding and other state funding, but much of this funding will end this month. We've really been fortunate that our Health and Human Services staff, the emergency management staff, and the county administrator have been able to maximize the funding that Richland County is eligible to receive so far. I just need to emphasize that without more state or federal funding assistance, the financial burden would fall on the county. New state and federal funding has not yet been passed, but there is funding legislation being considered at both the state and the federal level. So it's really important right now to be sure that our representatives understand how vital it is to provide assistance to local county governments where most of the work is occurring. All right, so I'd like to share a little bit about some of the other program information happening within the agency. Local law enforcement will complete training on Project Lifesaver on January 11th and 12th. Equipment for the program has been ordered. Individuals will be enrolled for the program through the ADRC. Once an applicant is determined to be eligible, the Sheriff's Department or Police Department will set the individual up with the equipment, and then we'll conduct monthly checks to ensure that everything is working properly. We should see our first people enrolled later in January. The ADRC's 5-week virtual caregiver boot camp event wrapped up November 30th. 29 caregivers attended the program. We received very positive feedback that the program had great topics and speakers, that it was informative, fun, and provided helpful resources. The Medicare open enrollment period ended this past Monday. Our elder benefits specialists worked with 210 people via Zoom, over the phone, and by mail to complete plans. Although this is fewer people than were served last year, it is still a very high number to be served during the COVID pandemic. There's a lot of information on benefits to share from economic support. First of all, a reminder that the marketplace open enrollment for health insurance through the Affordable Care Act ends next Tuesday. The marketplace is an option for individuals who are not eligible for Badger Care Plus or Medicaid and do not have access to insurance through their workplace. Eligibility extensions for Badger Care and Medicaid recipients continue through January 21st. Food share renewals are also extended, and the emergency supplemental food share that will be available, the emergency supplemental food share will be available again to members in December. The state has applied to issue the supplement in January as well. The program that provided food share benefits for families of children who receive free and reduced lunches for the end of last school year will continue for this school year as well. Right now, the Department of Health Services is working with the Department of Public Instruction to determine how these benefits can be distributed. The Richland Area Child Care Task Force sponsored an initiative to thank our local child care providers by giving them boxes of thanks. The boxes included various donated items, including hand sanitizer, masks, and gift certificates, as well as information encouraging providers to become regulated so that they'd be able to access the substantial resources available to support certified child care providers. The Wisconsin Home Energy program has assisted 526 households so far this season. This is up more than 7% from the same time last year, which speaks to the high needs during the pandemic. And in child and youth services, we are seeing that families are requiring more frequent contacts than usual. Staff feel this is due to the impact of COVID, causing families to experience stress related to the back and forth situations with schools, higher childcare responsibilities, and less social supports. In behavioral health services, counseling staff who are working with our intensive outpatient program completed a training on the matrix model, which is an evidence-based treatment approach to address addiction. Our school mental health counselor, along with the local mental health coalition, recently assisted the Richland and Ithaca school districts to implement the Y-Screen with high school students. Y-Screen is a screening tool that's used to identify students who may be at risk of mental health issues. Students found in need of assistance will be linked with services. And finally, our adult protective services staff recently completed 54 annual protective placement reviews for Richland County residents who are under guardianship and living in protective placement settings. And that's all I have for my report. Does anybody have any questions?
Hearing no questions, thank you, Tracy. We'll move on to agenda item number 5, Health Officer Update and COVID-19 Response. Rose?
Thank you. Thank you, Tracy, for providing the information that you did earlier. I did want to let folks know that we have seen some downward trending in testing numbers over the last couple weeks. And as a result, we've had a few less cases than we had during the months of late September, October, and November. However, the percentage of individuals who are testing positive based upon the numbers of those who are being tested does continue to increase. So for the fewer numbers of folks being tested, we are seeing a higher percentage of those who are testing positive. I know that folks have become aware that this past Monday, December 7th, the CDC, and then as a result of the CDC's release of guidance, the Department of Health Services here in Wisconsin reviewed and approved there being an early release from quarantine option. And those are a bit complex. And so we are working on, we have adopted those practices, and we are providing counseling to individuals for whom those new early release guidelines may be appropriate. So it's a bit complex, and it isn't as easy as it might sound. So that's something new that we're working with. And we're also ramping up for COVID vaccination administration. Again, lots of information is coming out. I know that I am working in concert with our local hospital, and then also with emergency management, and of course with the state of Wisconsin to get the information we need to get our staff trained. Sorry about that. And then to also take a look at when we might be able to begin that process. Of course, we have to adhere to all of the guidelines that DHS provides as far as a tier system, and then a sub-prioritization of individuals within each of those tiers, so that we can provide a vaccine to those who need it most urgently first, and then move from there. Also looking at storage, handling, and then gearing up or ramping up for mass vaccination clinics once our supplies of vaccine have been established.
All right, are there any questions for Rose?
How many people have COVID in the county?
So how many people would have COVID right now in this county?
As far as active cases, those that we're working on actively, we have 330 active cases. I calculated that this morning. And so I took a look at those who had been just most recently released between our Tuesday EOC briefing and this morning. And we do have 330 active cases.
How many have died in the county?
How many have died this morning? as of this morning?
Have a total of 13 that have been listed as individuals who have passed away as a result of COVID-related causes.
Mr. Chair, I'd also like to point out that I did put our most recent statistical information into your folder so that you could review that.
Wonderful. Is there any other questions? Dr.
Rose,
Barris?
Rose, can you hear me? Or I'm having a little problem with my mute button. Can you hear me?
Yes, go ahead.
Okay, regarding the prospective vaccinations, since there's going to be a little issue, I think, with storage and handling, is this going to be handled strictly by the health department? It's going to be, some of it go to the clinic or the hospital? Do you know how that's going to be handled?
I believe that the distribution, there is a plan that's quite specific with regard to distribution of the vaccine that will become available. There are hubs that have been established throughout the state, and those hubs or those sites will be receiving larger bulk orders of the vaccine. And then there's the state is using what they call a hub and spoke model. So the hubs have been established as far as where that initial large or the bulk orders of vaccine can be located. They will then break down those larger amounts of vaccine, and then distribution will occur to the spoke sites. And then that will once we do not have the capacity here, to store the products at ultra cold temperatures. However, we do have partners that are willing and able to help us with that. So we will. I know that all those who wanted to engage in vaccine administration had to complete an enrollment. I can't even think of the word I want to say. But anyway, we submitted our enrollment, and then upon approval, we will be able to receive vaccine. However, we will need to be very in tune with the product we receive, because it'll probably be out of its optimal storage conditions, and we'll have to have plans for distribution and administration of that as quickly as we possibly can. So I believe that a list has been generated for all of the vaccinators who have sought approval to provide vaccine. And I believe that locally our clinic, our hospital, and I believe public health, and then there may be some other entities that I'm not immediately aware of who may have submitted enrollment forms.
Thank you.
Are there any other questions for our health officer?
I just had a comment. We are working with the briefings, a lot of the information that's going to be going out. I don't know if any of you are interested in getting on an email list to get some of those press releases that I'm writing as they are released immediately. If you are interested, maybe just drop me an email and I can add you. I already do the county board chair, the mayor, things like that, and of course, local media. But maybe if you're interested, since you're on this board, that might be something that I can do for you as well. We're also encouraging citizen members to sign up for Nixle, which I could also send you that information via email if you're interested in that also, to keep you up to date on what's going on.
Yeah, I already use Nixle. That works out pretty handy on some stuff. They don't post very often on there, but it does give you some good information once in a while.
So Carrie, have you been receiving?
So, are there any other questions?
Have you been receiving the Nixle announcements I've been doing this week? Text messages. I'm struggling with text messages right now. So actually I've been doing Nixle weekly.
I haven't received any Health and Human Services ones, but I use my work email for those Nixle ones instead of my private email.
So
I get
have
Darren
access.
Gudgeon's Nixle, and
Yep, I have access to Darren's account, so I'm the one pushing those out. So I was curious, we're having some issues with Nixle locally, and I did 3 Nixle posts this week. So if you haven't received any of those, I would say you're adding to the list of people that we're having issues with Nixle.
alrighty.
Yeah, it's too bad.
Well, let's move on to agenda item number 6, review and approve Health and Human Services vouchers. Robin, I see you're here with us today.
I think Angie is actually going to go through the vouchers. Robin just got back this week, so I know she'll help with the budget report, but I think Angie's doing the vouchers.
Yep, sorry, I
Wonderful.
put myself back on mute and I didn't take it back off, sorry.
And does everybody see the vouchers on their screen?
Yes.
Thank you.
Okay, so we've got $27,720 and a penny. So if you want to go to the next page, mileage expenses are starting for the transportation drivers. So go one more page, and that continues through page 2, and then page 3. There we go. This starts the voucher reports, and I'm just going to mention some of the ones that I think you need. I didn't know what they were, or that need a little bit more explanation. Maybe they're a little higher fees. So right on page 3, where we're at, right at the top, behavioral health training partnership, the conferences and registration. Yep, number 1 for $459. I just wanted to, that's not actually registration for a conference. It's our annual training membership fees. So I just wanted to let you know that's a little bit high for anything related to a conference or registration, but it's an actual annual fee. So then just below that starts card member services. And it's all that rest of that page plus continues up on, continues up on page 4 to the top. And there you'll see the total for the card member services vendor is $3,530. There you go, $539.68. In that is our credit card bill, our agency credit card bill. And there's a variety of COVID purchases there that we had to make, as well as some client items for children's long-term support. And we also did some building maintenance updates of some emergency lighting that was a good price on Amazon for us. So that is what those for those 2 pages. Next, we'll go to just a little bit down from that is Crawford County HHS. Voucher number 2, $220.54. I've never seen us pay them, and what that is a pandemic plan. Some fees that I'm guessing Rose was involved with Crawford County to have the pandemic plan created. Little bit further down from that, right below it is Gander's Cleaning Service, $1,350, voucher number 5. As we've talked a few times over the last couple of meetings, Gander's came in and was willing to do some emergency cleaning for us while we had some staffing issues due to COVID. So he was here. The $1,350 is for 3 weeks that they provided service on in October. So that is the final bill, the one and only for this year. A little bit further down is voucher number 7, Grant County Health Department, and that's our quarterly environmental health consultant fee for $2,125 for Troy Morris. Language line starts at the bottom of this page and then continues on to page 5. And that again, this month is substantially larger than we've usually had, at $556.88. Usually we're only paying the $50 membership fee for them. But we are, with COVID and the need to have a lot of translated conversations or largely Spanish speaking translation, that has gone up quite a bit. So that's language line. Just below that, I didn't know what LK Design Studio was for voucher number 60 for $500. And that is it's campaign materials for, the campaign is called Not in My House. It's a incentive grant monies that we're using to decrease youth alcohol use. So it looks like they're doing some materials with them to promote that incentive. Just below that one as well, voucher number 10 is Marco for $1,428. That is for soft phones purchase for the ADRC, which is going to be in a little bit on our agenda. It was an emergency purchase when we closed the building down, and we'll talk about that a little bit later on the for that line item. But this is the actual bill we received already, because we've already received those items actually earlier last month. So that is 1,428. Yep. Okay, and just a couple more. Just down from that on this page, number 11 is passages for $1,300. And that is our second half of the annual pass-through payment that the county pays passages for their services. And voucher number 43, right below that, is Project Lifesaver, which Tracy talked about a little earlier. That is $975 that the ADRC had some additional monies for. So that purchased 3 additional one-year transmitter kits, and they were $325 each. So that's been purchased. And the last one I wanted to mention, because on this page just starts Quill Corporation, which is a lot of office supplies. So we can go to page 6. And middle of the page is voucher number 21, and it continues down to the end of the page, the Richland Observer, $1,420, quite large this month. And what I found in there is there's a few HR positions that we had to advertise for vacancies. There was also a large public health grant for the SOR grant funds that needed to be used to advertise for that. The ADRC did a number of advertising efforts for voter rides as well as volunteer driver recruitment. So that's what a lot of those Richland Observer ads, why that's such a large bill this month. That's all I had to point out. Any questions from me?
I have a question. What do you mean by HR positions that you have to advertise?
So we've had, we'll talk about it a little bit later, but there has been an information and assistance specialist vacancy. So we had to advertise as if we have to do a minimum of 2 weeks in the Richland Observer, and then we also do the shopping news. So that position, I just not included in this bill, but we also have another vacancy that'll be running as well, an ad for 2 weeks in the Observer. So those are just as we need those.
Are there any other questions? If not, we would need a motion to approve our vouchers.
I motion to approve the vouchers.
We got a motion by Debbie Kaiser to approve our vouchers. Is there a second? I will second to Dr. Barris. Is there any discussion, further discussion on our vouchers? Hearing none. All those in favor signify by saying aye. Aye.
Aye.
Aye.
Those opposed say nay. Motion carried. Now, I believe, Angie, are you going to send out an email where we need to reply and say yes?
Yeah, I will do that again.
Okay. So remember to turn the email back into Angie that you approve them so Victor can go ahead and take the proper steps to get these paid. So then we're going to move on to agenda item number 7, our 2020 budget summary and county placement report.
All right, well, thank you all for the nice welcome back. It went way too fast for me. I'm sure not for Tracy and all you guys, but.
Has it been 2 years?
Yeah, today's my 2nd year anniversary as well. I kind of forgot about that. Okay, so we do have a board report to go over. Okay, you can all see that. Starting on the left-hand side, you see that it's 92% utilization is where we should sort of be at this point in the year. That's not actually really accurate because we have 3 payrolls in the month of December. So the more accurate number is around the 80% mark, 75 to 80, because we're going to have 3 payrolls hit in December. So anything that's around 75 to 80, I'm not really going to comment on because we know we're going to probably expend that budget. So the first one I'll mention is public health is now at this point overutilized, which the extra staff due to COVID, and we've got CARES money to actually cover that. So we're good there. Going down to would say behavioral health are the other ones I wanted to mention. They're the ones that have carried through all along. So these are ones I've talked about several months. The AOTA outpatient is 58.5, APS is 52.7, and CLTS, Children with Disabilities, is 61. Two of them, the first two were because of unfilled positions that we've had, so we're just not going to expend that budget. And the children with disabilities, we just have less kids in the program, so we're not going to spend all that budget. I do want to back up a little bit and talk about the detox services that we're at 272%. With the detox services, we can't control the amount that we spend in that budget. Law enforcement makes the order for someone to go to detox. And we set the budget usually on one person or what we may spend in a year, but this year we had a couple other invoices come through. So I've confirmed with Miranda, those are in fact correct. So we are going to overspend the detox budget this year. Any questions on that?
The law enforcement makes the final decision on whether someone goes to detox, or is there a physician involved that does that?
Miranda, do you want to comment on that?
Sure. So it is with the physician and the medical staff in the emergency rooms as well. But then a legal detox hold is under Chapter 5145, and those are approved by law enforcement.
And then what about voluntary? Would we be paying for that too?
We do not pay for voluntary detox.
Okay.
Any other questions on that section? If not, I will move forward to the middle section. As you can see, the first yellow box is negative $476,371. This right now is where our actual budget is sitting. But that also includes the Winnebago placement charges in that number. I've confirmed this week with the clerk's office being short of staff and with the auditors that we're going to be able to make that chargeback that we've been talking about happen, because the logistical behind the scenes, we actually did get a payment, and we need a payment to basically, I know I'm kind of talking deep here, but to make that process happen. So I was very excited to find that out this week. So I was kind of nervous that we were going to end that way, which it's not all necessarily bad. It's just harder to break the two out in AS 400 then. But pending everything goes well, the second yellow box is likely where we're going to end for the year. And I wanted to mention as well that we've been calling this budget balance. It's more of been a year-end projection, because we ultimately need the revenues to cover those expenses. So at some point I'll probably change the wording on here. But one thing I did want to mention on that 159, I think at this point, there is some gray to this number. I just got back. I've tried to review all the details very much as I can, but I know that the clerk's office is behind without having Derek there. So I'm unsure what's sitting over on the desk over there that's not posted. So I want to say that with a caveat, that's the best number I can give with variables that may be outstanding. But what has sort of led what I've been able to uncover to that surplus is the fact that we didn't budget for us getting that 70,000 in WIMCR, as well as there was enhanced funding from the IM program that we didn't budget to spend, which we actually are budgeting to spend it next year. As well as we did get some COVID money for some lost billing revenue, and we didn't initially budget the year to spend that either. So that's sort of, it's not that we're not spending somewhere funds, it's we've got some extra funds that we hadn't counted on. Tracy, do you have anything else that I missed?
No, I think Robin explained that pretty well, that, there are revenues that we are receiving in 2020 that we had not planned on. And so that's what's pushing the potential surplus. And I think it's important that Robin had emphasized that she just got back this week. She's been working feverishly to try to put together this budget report. And so I think we have a fairly good estimate, but we know that there are a lot of factors that will come in, and I think we'll get a clearer picture when we meet again in January.
Well, then there's one other thing I forgot to mention. We still don't know our WIMCR number for this year that's going to be happening within the next couple of weeks. So that could we're hoping to positively even more impact that number.
We've been pretty fortunate with the WIMCR payments in the past couple of years, and especially that recent review that they did over the summer, where they took kind of a deep dive at how we're utilizing the tool and if we're accurately reporting all of our expenses, resulted in that extra $70,000 that we were pretty happy to receive. Yeah, we may see this number kind of stay around that 159,000, or potentially, if all things remain the same and we get another good WIMCR payment for the year end cost reconciliation, we may see that go up. That would be good news, because our placement costs are extremely high, and that might help us actually cover all of the placement costs this year. So I could move on to the placement report if you would like.
I think that would be fine.
Okay.
If nobody else has got any more questions on our summary. Okay.
So I'm switching the screen over to the placement report. As I said before, especially with institutional placements, we've had an extremely high year of placements. So in adult, institutional, and inpatient placements, we did have another 88 days in October. We were fortunate that we did receive a pretty large Medicare reimbursement, so that kept the cost of October down. But we know that November still will be a high number of days as well. So for adult, institutional, and inpatient stays under crisis stabilization, we have expended $41,876. For adult, institutional, and inpatient stays, $730,725. And I will scroll down to the adult community residential placements. Those placements, except for a couple, are now being covered almost entirely by CCS. I will remind you that we have that one very large, very expensive placement that we entered into this year. And so until we do the cost reconciliation, we won't see full reimbursement for that placement. So we're really hoping that that will take place in 2021, but that is driving up the cost of our residential placements, which are mostly being reimbursed by Medicaid under CCS. So adult residential placements, we have expended $302,950. So the total adult placement fund, Fund 54, we started the year with $482,278. We have now expended a total of $1 million, $75,551. That leaves that fund $593,273 in deficit. And I will scroll down to the child placements. For child institutional, inpatient, and detention placements, this has stayed relatively steady. So for child institutional placements, we have expended $204,784. Detention costs have been $36,725. And I will scroll down to the child foster care and treatment foster care placements. We have had some additional placements, as you can see. So the year-to-date group home and treatment foster care placements has been $167,464. And the regular foster care expenses has been $23,470. So that's for Fund 44, which is the child placement fund. We started the year with $527,341. We have so far expended $432,443, leaving $94,898 remaining in that fund. I'm going to switch over to a screen to just show you the comparison and kind of where we expect the year to end. So again, this graph shows the past 3 years in placement expenses. The gray is 2018, the light blue is 2019, and the dark blue is 2020. So you can see that we have had substantially higher placement expenses this year compared to the past couple of years. So overall, as you know, the Fund 44 and 54 combined, we started the year with $1,009,619. There was no carryover placed into those funds. We mentioned this last month that the Finance and Personnel Committee declined to transfer that $551,000 into Fund 54 with the rationale that they were concerned that if they did that, it kind of hides the fact that those funds aren't adequately budgeted for. So if our expenses continue in these last 2 months as they have throughout the year, we will likely end the year at $1.8 million, $1,809,592. That would create a deficit of $799,000 for placements. So when Robin talks about the potential of having funds remaining in our core budget and that $551,000 that's sitting in the general fund that was returned following 2019, there may be enough funds to cover this. It doesn't help with other county concerns and expenses that might have been counting on those extra funds flowing somewhere else, but this is the reality of our placements. Does anybody have any questions?
I have a couple. So I know we've been talking about this at some of the previous meetings. There's obviously been different factors that have played into this as far as this year being so particularly high for placement. And I also know that you're really working on the residential or in our community placement end, which I think is great. This is such a complex issue that even though I sat on this board for several years now, it's still difficult to understand all the parts that go into this. So I guess what I'm asking is I would like to see a little bit of information for us as board members so that we can understand what are the processes that someone goes through where they wind up getting an institutional placement. I don't know if that could be in some sort of document, but I know we've talked about it multiple times, but just as far as how do they get to that point? And the reason why I want to do that is because I would like to look at, if we're looking at how can we get them into our community in a placement that will be covered, what about on the other end of of this problem as well? Can we address anything there? And in that vein, I guess another question for you would be, do you have any information or resources based on your associations with other counties, other HHS, as far as, because I'm sure that this is a problem in other counties as well. Is this talked about at maybe some of the annual conferences? Are there different strategies that other counties are utilizing? I just want to have some sort of conversation about that. Does that make sense?
Definitely. So, you know, a couple of years ago when we started utilizing the placement report, we did kind of a presentation explaining all different types of placements, and it's certainly, that's a lot to take in, I think, for anybody. So I do wonder if it would be helpful for us to do that again, and maybe on some regular basis. I know that we have some new board members, and it may be helpful for us to provide that presentation and go a little bit more in depth in why these different types of placements occur. That's one of the things that you're asking, it sounds like, Ingrid.
I'm sorry to interrupt, but remind me, did we have a document with that presentation when you did it?
Yes, there is, and in your iPad folders, there's a resource. I think it's called Health and Human Services Resource Documents or Resources, and that document is contained in there.
Okay.
And I think there may be two documents, one that kind of walks through how to read the placement report, because there's a lot going on in that document. And then also a narrative that I think Miranda and Jessica put together explaining each of the placement types and how those placements might occur.
Okay. Is there any chance, I'm afraid sometimes it's hard to search through and find that. Is there any chance you could get those emails?
Oh, definitely. Yeah, we can do that. The other question I think you had asked was, does this get talked about with other counties? And certainly it does. I attend a monthly directors meeting, and it certainly gets talked about there. It does get talked about at the mental health meetings or the child and families meetings that Miranda and Jessica attend. This is a problem across the state, and it hits counties at different times, especially the small rural counties, because when we're so small, it just takes one or two significant placements that really hit us hard. And in looking at our placements, we hold a monthly placement panel and review what's happening with each of these placements. We've had 3 individuals who've had pretty significant mental health concerns, and we're really seeing the increase this year in those mental health institutional costs. We've had some individuals due to COVID, they've had to be quarantined while on the unit at Winnebago and unable to be discharged as soon as they were clinically available to be discharged because of being in quarantine, which extended our stays and our expenses. We've had some pretty sick individuals who really needed, for safety reasons, to remain in the institution. So this is a problem across the state, but it hits each county at different times depending on what's happening with our individuals who are experiencing these issues.
The ones that were quarantined due to COVID, was there any increased reimbursement because of that?
I'm sorry, I couldn't quite understand you.
Oh, I'm sorry. The placements that wound up being in quarantine during the institutionalization, was there any increased reimbursement because of that?
No, unfortunately not. And because they remained on the institution, we had to pay the full daily rate for those stays.
Okay. And then you mentioned that this is talked about monthly. Are there reports on, like, other counties that would be similar as far as demographics to us? Are they in a similar spot this year with the increased deficit, with the increased institutionalization? Are there any reports on how these counties are addressing it?
I'm not aware of any reports that are shown for, what's happening with placements across the state. Sometimes we're able to ask the state to try to pull some data for us on that, but they don't routinely put that out. I don't know if Miranda, you or Jessica are aware of anything. No, I see Miranda shaking her head.
No, there isn't one
Yeah.
report like that.
So in the discussions, when you do meet monthly and discuss this, is it just kind of an informational, like this is happening, or do you guys talk about any strategies or how people are trying to look at the problem?
Yeah, we go through each individual who's in a placement and talk about, especially for those placements that are not certainly foster care placements, we recognize that some of those are longer term placements. And when we know that, we don't spend as much time on those. Individuals who are institutionalized, we talk really in depth about kind of what is the plan, what needs to happen for that transition to the next level of care. We are holding a special work group to really talk about how we might more broadly look at how quickly can we transition people to another lower level of care when it's clinically appropriate, to try to ingrain that more in our system. That would be ensuring that we have the resources necessary to do that, like using crisis stabilization facilities or step down facilities like adult family homes or group homes. So we're just beginning to have that meeting just to look at, are there resource issues that have gotten in the way of us making these kinds of transitions? Miranda, is there anything else that you would share on that?
Yeah, I would just say that staff work very hard, but it has been a particularly challenging year to move people as quickly as we would like without sharing any specific client or patient details. I would just say that health and safety of the individuals is the priority, as well as at times health and safety of the community, and both those things play into the longer term placements.
All righty. Are there any more questions on our placement report?
Mr. Chair, this is Supervisor Gottschall. Am I permitted to ask a couple quick questions?
Yeah, I'll give you time to do a couple questions.
Thanks, Gary. Hey, everyone. Good to see you. Tracy or Robin, could you explain the chargeback term that you used? I think I understand that, but I want to make sure.
I'll jump in and ask Robin, you can correct anything if I misspeak. What we've done, and probably as you know, Tim, Winnebago pulls the expenses when we have a placement from our allocations that we get from the Department of Health Services. And those allocations are intended to fund many of our programs. And so when they pull that funding is not available. And so the chargeback process is to charge when those expenses are taken out of our core budget because of removing it from our allocations. The county clerk's office is charging back those expenses to the placement funds. Am I saying that correctly, Robin?
So we call it chargeback, but basically, Tim, it's just a whole list of journal entries. So once we actually get a payment, which wasn't going to happen this year because our Winnebago charges have been higher than our allocations. But once we actually get a payment, our auditors helped us work through writing a journal entry. So basically, it puts all the expenses for Winnebago into the placement fund, and basically on the books, it looks like we've got all of our allocations in the core budget.
Awesome. That clears it up. Thank you. I'm really glad that you were able to do that. I think it
too.
paints a more accurate picture for what's going on. My only other thing, Mr. Chair, would just be a comment that these expenses are important and need to be paid. I would recommend that we start to bring forth a conversation to finance and personnel and forward to the greater county board. If we're looking at potentially a $800,000 shortfall. We made a lot of budgetary decisions as a county based on having some cash balance. And if that's in jeopardy for whatever reason, I think we want to start having that conversation. Thank you.
All right, is there any more questions or discussions? Hearing none, let's move on to number 8, our 2020 contract monitoring report.
Okay, and that's me again. There it is up on the screen. Things are looking pretty well for contracts. Boy, it got really dark. I'm having issues with the lighting this morning. I'm sorry if you can't see me. So for October is what we're looking for. Most of the bills have come through October, which is an 83% utilization. So on the far right-hand side, I'll be looking at any of these contracts that are fall over that 83%. So right at the top, the second one, the Children's Hospital Wisconsin, that is at 84.44%. But if you notice, if you scoot to the left just a little bit, Tracy, their current month invoiced is November. So they actually are trending quite well. They've just billed us for one additional month than what I've been monitoring for, which is the same with Cholita Institute, which is just below them. They are also trending over the 83%, but they have also invoiced us through November. So they should trend just fine. Right in the middle, one we've been talking about all along is that Family and Children's Center. They're at 85% utilization. But if you remember, every month I keep talking about how we don't intend on using them again. Their expenses were a lot early on in the year, and in essence, we don't plan on using them through December. So that's why I've listed current month invoice as December. So that should trend just fine come the end of the year. So all on page 1. Page 2 is looking good. Don't see any issues there. Page 3 also trending quite well. The far right, there's nothing over the 83%. Page 4, same thing. Everything's trending really well there. Page 5, right at the top, Cario is at 86%. And once again, that is because they have invoiced us through November. So there are a few vendors that do that. They invoice right away, but a lot of them are a month or two behind in billing us. Page 6. Everything there looks okay. Of course, Winnebago's at the bottom that we've been talking about all along. So everything's looking really well on a contract side for where we are with the amounts expended and monitoring those. Any questions for me?
Wonderful. Let's move on to our contracts, agreements, and amendments.
So that is summary number 1. Yep, there it is. And we have one new contract for 2020 that started, and then we have 2 additional new contracts that need to be added for 2021. So 2020, Jess is the Fond du Lac County Department of Social Services, and then we've also continued that placement through 2021, so that's why you see it on here twice. So I don't know, Jess, if she's on, if she wants to talk about that.
Sure, I can. So this is actually a youth. We were able to find a placement through Fond du Lac County Department of Social Services. It's called the PACE program. So it is at the secure detention there in Fond du Lac County. However, we are able to provide that the youth is receiving treatment and services in that location. So it's very similar to a residential placement, but at the secure detention facility. This is the youth we've been accruing a lot of secure detention costs for this year, and we're having difficulty locating a placement that would be suitable for this youth. The anticipation is that that this is a 6-month program in which we would then have time to locate a group home for that youth to step down to after that or as that treatment is being facilitated. So this is just another location that we found, and it does allow for the youth to move out of just secure detention into more of a treatment type facility.
All righty. We heard a description. We need a motion to approve this. I think we'll just do the 2020 contracts in one motion and then 2021 in the next motion. So this motion now would be to approve for what was just talked about at Fond du Lac, Department of Social Services. So would anybody like to put that on the table?
I do.
All right. So we got a motion by Debbie Kaiser. Is there a second? I will second that motion for not to exceed $15,000. Is there any further discussion? Hearing none. All those in favor signify by saying aye.
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 Opposed, say nay. Motion carried.
Then for 2021 continues, Fond du Lac County, as Jess described, the placement into that year, as well as the Richland Hospital, which I don't know if Lori's on today, or if Miranda, if you wanted to talk on behalf of the Richland Hospital. Otherwise, I do know what's going on if you don't.
Yeah, sure, I can speak to it. So if everyone remembers, we are transitioning therapy services for our Birth to 3 program to CISA. However, CISA has been unable to locate an occupational therapist, so we'll continue with the Richland Hospital for a bit longer and needing that contract for 2021 for occupational therapist for Birth to 3.
And
Thanks, Miranda. I had questions about that since I was the one who discontinued the services, but I'm glad the hospital has the capacity to continue to provide services for a bit longer.
Yeah, we're very thankful for that too. Thanks.
all righty, so we would need a motion to approve. You can do these both at once, right?
Yes.
Okay, so we would need a motion then to approve the Richland Hospital's Birth to 3 program, and then also Fond du Lac County Department of Social Services for the PACE program. So would there be a motion to approve those two?
Move.
So we got a motion by Supervisor Nelson. Is there a second?
I can second.
Seconded by Supervisor Glassbrenner. Is there any further discussion? Hearing no discussion, all those in favor signify by saying aye.
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 Those opposed say nay. Motion carried. So next we'll be moving on to personnel updates at agenda item number 10.
All right, well, we have no new hires or probationary completions to report. We do unfortunately have a resignation to report. Amber Platt, who's mental health therapist and does a lot of our crisis work, had submitted her resignation, and that will be effective January 8th. We're really sad to see Amber go. She's really done a lot to help develop our crisis program. And then I also would like to let you know that we did hire Becky Dahl, who some of you may know as a former regional ADRC manager. Becky is doing some of the work with public health, and she was hired as of November 16th. I believe that is all of the announcements. I think this is all for the board's information and does not require any type of approval any longer. We do have now 2 vacancies with behavioral health services, I believe, and 1 vacancy with the ADRC, the information assistance specialist that we announced last month, and we're currently setting up interviews for.
You mentioned that this would address the HR advertisements. Was this what you were referring to?
Yeah, I
Yes.
believe that's what Angie was talking about.
Yes, so not this specific resignation of Amber, the mental health therapist. That'll be on next month's bill from them. But there were ads ran for the information and assistance specialist that right now we're interviewing for. Interviews are this Friday, so hopefully we'll have some better announcement in the next couple weeks.
For the mental health therapist, you're advertising for 2. Is one of those Amber's position, or will that make 3?
No, we are not currently advertising for 2, but now we have 2 vacancies in behavioral health services. I believe one is Amber's position, and actually the other is a substance abuse counselor position. Is that right, Miranda? No?
The other is a CCS. It's advertised as a mental health therapist, but it would be a mental health master's level case management.
DCS, thank you. So,
And you currently have those leased employees working in that office as well, right?
that's correct.
This might
Tracy,
answer
how
me-
long was,
It might be a little more helpful when we go to the org chart next to kind of, I can lay it out a little bit better and show the vacancies.
Okay. Dr. Barris?
yeah, how long was Amber employed and what was the reason for leaving?
I believe Amber was employed for 2 years. Miranda, looks like you were gonna speak. Go ahead.
So she was employed a little over 2 years. I think she's comfortable with me sharing that she is moving on to the community. She's going to work with Pine Counseling. She just was fortunate to finish her 3,000 training hours this month and has just decided to use that resource a little differently in the community at this point.
I don't know, I certainly didn't hear anything specific from Amber, but I am concerned, with the level of our wages, that we're not competitive. If people have opportunities out in the community, I think it does create an issue for us. I think when we look at our staff survey, which I wasn't going to go through in any detail, you'll see that there were some comments about the wages not being competitive. And I think that's one of our factors. Once people get all of their training and certification, we don't have as much hold on keeping them here.
All right. Angie, do you want to go over the review of our organizational chart? Agenda item number 11.
Sure. So organizational chart, if we go to the second page there, is for actually Cindy, I'll just explain a little bit of the layout. So each page represents a unit within our department. So each of Tracy obviously is at the top, and then each of the blue blocks are actual units within our department. And then each block is broken out underneath on each page. There are some little cues at the top, little icons of what things mean on the upper left and the upper right to keep you updated. I did add a block when we get a little further out that's different because of COVID. So when we get to that public health page, I'll explain that a little bit more. But this page is the administration and building operations. So everyone in yellow is considered management, and green is full-time, purple's part-time. There was a small change here. Second column, Debbie Mitchell was brought in. Fran Ewing, I believe was her name, lasted a couple weeks here, and we were looking just to fill an LTE secretary through the end of 2020, so the end of this month. And Fran wasn't able to stay on, so we did fill it with a Debbie Mitchell. That is a leased employee that's helping us out with a bunch of our CCS filing to catch us up before the end of the year. And then she's been on roughly a couple months, and then yeah, she'll be done the end of 2020.
I'll also point out, you'll see next to Debbie's name that little plus sign, and that indicates the leased positions, correct, Angie?
That is correct, and that'll be helpful as we keep going through the sheets. You'll see those are the, not everyone, Carrie, are we looking for the leased proposal. It's just the full-time people that have a plus by their sign that we're looking, plus sign by their name that we're looking to potentially transition to county. So on this page, that's where Dennis Drake is listed there, cleaning and maintenance. He's the third column over. He is one of the positions that we were looking to transfer to a leased, or from leased to a full-time county position. If you want to go to the next page, I just will point out any changes. So this is the Aging and Disability Resource Center. So the far left column, the second block there is the vacant information and assistance specialist. That's the Christine, who we lost last month, that we are actively interviewing for this Friday. Otherwise, no change there. The next page there is behavioral health services. So there's some activity here that's changed. If you notice under Miranda, the second to the right is where Amber Platt is listed there. That is who just has resigned. We were just talking about. She's a mental health therapist that works primarily with our crisis programming right now. If you go down to the blue block on the left, mental health outpatient clinic, there's been some activity there. Kyla Luther, the second column in, Kyla has, she was a leased employee for us for a while, and then we had a vacancy for our substance abuse counselor county position, and we Kyla actively interviewed for that and was accepted that position roughly, I think, last month. She started in that full-time county position. To the right of her is Trisha, and Trisha is a mental health therapist who works primarily with substance abuse. That's why I put that in parentheses as well, where you'll see then if you continue over Cindy, and then there's that vacant mental health therapist there. I did not know when I prepped this that Amber was resigning. So that block up above will go into a vacant status as well. So we'll have two vacancies on for mental health therapists. Just below where we were at that under CCS, that's where you'll see the three blocks, Corey, Faith, and Laura, that are all full-time Southwest Workforce Development Board or leased full-time employees that are service facilitators for CCS right now. And those are the three that we were talking about transitioning to county positions. Where there are on this page, there are some leased staff that are in purple that are part-time that we don't intend on transitioning to county positions. There is one more position on here that we would be looking at transitioning from full-time lease to county. And if you look back on that row where Amber was, the far right, Danielle Relke, is the crisis caseworker for the Richland School District. And we're proposing her position as well, go from leased full-time to county. You'll find a lot of individuals, so I think 3, 4, 5, I think is what I'm seeing, that have the little eyes behind them. And they are independent contractors that we work with. For example, on the far left, the purple attorney, Julie Dadoon, she has an eye behind her name. We contract with her to do the corp counsel work as a standby. And then just to the right is Thomas Tranel, who is our clinical director as well. So to give you kind of an idea of, this is the only sheet that has those little I independent contractors listed. They're usually psychiatrists, psychologists, which they'll continue down under mental health outpatient clinic. You'll see some of them down there below there as well, Dr. Warrior and Dr. T. Any questions on that page? I know there's a lot of information on that one. It has a lot to do with what's kind of on the docket recently. Otherwise, we can go to the next page. Page 5. Yep, so that's the business and financial services unit. No change there. Page 6. Child and youth services. No change there. You'll see I want to just point out far right, the Julie DeDune. She also works with our children's unit as an independent contractor as well. So that's why she's on there too. Page 7 is economic support. No change there. And the last page is page 8, which I've done a lot of additions here this month. Largely, we wanted to see the footprint of COVID and how public health really has called upon or has needed the assistance of a lot of other unit full-time staff to respond to the COVID pandemic. Because if you look under rows, just slightly to the right, the 4 green blocks, Brandy Anderson, really was her only full-time nurse going into the pandemic other than Rose. Carlene Shaw is just below her. We did, I don't know if you want to say borrowed or reassigned her from her psychiatric RN duties, that she's actually on the behavioral health page as well. She was reassigned to public health so that they did have those 3 full-time county nurses that were able to respond to the pandemic. Below that, we have 2 vacant public health nurse positions. One is a clinic nurse, one is an actual bachelor's degree nurse. So those are there as well that were vacant at the time of the pandemic. So anything from Brandy Anderson to the right are all positions that were part of public health before COVID started. So a number of those staff may be responding and helping as well with the pandemic, as well as doing, for example, Tanya, the nutrition program coordinator, is also working as contact tracer on when she's available, other than doing her nutrition program duties. Where everyone from Brandy Anderson to the left, under that orange category that I added on this sheet, are all staff that have been either newly added as leased, which are the far left column, starting from Becky Dull, who is the full-time additional person that we've added, a public health consultant. All the left-hand column are all LTEs, so limited term employment. That means once the leasing agency knows that once the pandemic or when we determine that we are not in need of their services anymore, their positions will be eliminated, but those are largely part-time, after hours kind of assistance that we're getting. Notice the 3rd block down is another vacant LTE public health clinic nurse that we decided recently needed to be added in, hopefully in January, we'll be able to fill that. Otherwise, in the middle there, the orange, the second column is a lot of testing site individuals. So these are full-time county positions that are in other units of the org chart that we've already talked about that have been pulled forward to do testing site work. So they'll go out and do that, usually on Mondays right now. They work those testing sites and we have a rotation for them. The 3rd column is all of our contact tracers that we've added on. I'm sorry, 3rd and 4th column. The majority of those are all contact tracers that work full-time county positions and then after hours, nights, weekends, work as contact tracers to help with the response. And the bottom right, Steph Ronfeld's listed. She is also active participant with a recovery work group that meets monthly in response to COVID as well. And then myself to the far right of Rose doing the Richland County PIO Public Information Officer work as well. We just wanted to give a kind of a snapshot, a look at what the response has been offered by HHS staff for the pandemic. Any questions?
I'd like to add that in my report at the beginning of the meeting, I misspoke. I mentioned that there are currently 3 LTE staff working in public health, and I am reminded by looking at the org chart that there are actually 4 LTE part-time staff.
There is an ad, the LTE vacant public health clinic nurse. There is an ad, not from us, but from the Southwest Workforce Development Board that's being ran to recruit for that position, and in the hopes of interviewing and filling in January.
Another thing, just as I look at this, you might be wondering, so we have a vacant public health nurse position and a vacant public health clinic nurse position here on the chart. And those remain vacant, recognizing that we need to know that we can fill them and have budget beyond COVID for that. One of those positions probably can be filled, and we've delayed that and instead reassigned the psychiatric nurse over to that was a strategic decision that allowed us to capture some specific funding for reassigned staff. So there will be a point where we advertise for that clinic nurse. In all likelihood, the psychiatric nurse might apply for that, but that's why those 2 positions remain vacant, even though we've been hiring all of this other staff that are temporary staff.
Okay, are there any other questions? Hearing none, we'll move on to our next agenda item, which is number 12. We will review the results of the 2020 staff survey.
Yeah, so I placed this in your folders, and if you want me to kind of go through it a little bit, I can. I think the relevant pieces, it's a 40+ page survey document. What we did is in September, we used the same questions that we used last year to get feedback from our staff on just what they think about their work, what they think about the agency and their employment. We used many of the same questions so that we'd have something to compare. We also added questions related to working under conditions with COVID, as well as working under conditions of remote work options. So you'll see when you page through the survey that you can see what staff responses looked like for this year. And then we also included what their responses were last year for some comparison. I'll share my screen and give you some examples of that. But I recognize this is a pretty long document, and it's not my thought that you will want to go through it in great detail. So there were 47 questions, I believe, that we asked staff. This shows what the response was. Our response rate was not quite as good as it was last year. Last year, we actually had a 92% response rate of our staff. This year, it was 65%. Hard to know exactly why that was the case, but certainly Many staff were working remotely, so the logistics of them completing and returning their surveys may have entered into it. The novelty of doing a staff survey may also have been a factor. 65% is still a pretty good return. We would have liked to see it bit better and closer to that 95%. The survey had a checkbox so people could identify what program unit they worked in, and so that helped us see what the responses were from the different units as well. So you can see this chart here shows how many people responded to the survey from the different program units. So I'll scroll a little bit more. This is just the email that was sent out to staff asking them to complete the survey. This is the survey that they actually completed. We included a column to ask staff if their response was more positive or more negative because of COVID, because these were the same questions they were asked last year. And I think our management team really wondered if COVID would impact their responses. And so that's what we did to try to capture that. Then you can see we asked several questions related to the response to the COVID crisis, as well as some questions related to working remotely. So then as you get in, each page then shows really what the results were to each question. So this example here, I received sufficient orientation and ongoing training to do my job. 70% of the staff agreed or strongly agreed with that. Last year, 73% agreed or strongly agreed. So we saw that didn't change an awful lot. And then below that, there is the box that says 3 of the respondents indicated their answers were more negative because of COVID, and 3 indicated that their responses were more positive because of COVID. And then staff had a space for each question where they could include any comments if they wanted to. And so here you'll see that one individual wrote that the initial training was not sufficient. One person responded on their comments a long time ago, and another had been here a long time. So each line indicates one comment that was made by a staff. I'll jump to, I guess, some areas that I think might be relevant. So you'll see a lot of these where the responses weren't substantially different from last year, but there were a few that were. So pardon the scrolling here. Jumping. So this was a concerning question for me to see. The question was, oh, excuse me, this was a more positive, pardon me. Staff saying that they feel valued for their contributions at work. So last year, 58% of the staff said that they felt valued, either strongly agreed or agreed that they felt valued for their contributions at work. That was pretty concerning to us last year, and this year 73% said that they agreed or strongly agreed. So that was a nice improvement to see. This was a little bit less. The mission makes me feel that my job is important. We saw a little decline there. Interestingly, nobody indicated that COVID was a factor for them there. So this year, 73% said that they agreed or strongly agreed with that, but we had 81% agree or strongly agree with it last year. If you pardon me, I'm going to scroll a little bit more. And again, I'm just kind of showing you a couple of these. This question, there's a strong feeling of teamwork and cooperation at Health and Human Services. This actually showed to be worse than it was last year. And I was concerned that it wasn't very high last year either. 61% of individuals agreed or strongly agreed with that last year. And only 50% of our staff agreed or strongly agreed with that this year. We did see more staff indicate that COVID, their response was more negative because of COVID. But this certainly is a concerning response for us. What we will do with this, two things. One is this survey has been shared back with our staff, but we will ask staff to help us prioritize areas that they'd like to see us focus on and work toward improvement. And our management team will be meeting in January to do some annual planning, and we'll be utilizing the survey results to help us put some priorities in place for our annual planning. And I'm going to jump down to just a couple of more spots. I'm sorry for scrolling past so quickly here. I wanted to jump down to what we see from staff on longevity. So staff indicating that they foresee themselves working here a year from now. 92% agreed or strongly agreed. That's up from 78% last year. 3 years from now, 68% indicated that they would see themselves working here 3 years from now, agreeing or strongly agreeing with that, up from 55% last year. So it's nice to see that tick up. But the comments that we got is the concern about the pay scale and adjustments. So that seemed to be things that we hear verbally from our staff, but it also came through in the survey. I'll also show you the 5-year question. So I foresee myself working here 5 years from now. 54% of the staff agreed or strongly agreed with that. That's up from 43%, which is good to see that increase. But again, wage scale and benefits not worth it was the comment. And again, that's the verbal comment that we hear occasionally. So it does concern me about maintaining our workforce. I just have been kind of looking at the year end. We have seen a significant less turnover this year, but at the same time, I know that keeping staff is really just vital for us to maintain our services, and it also helps us with preventing placements if our staff are able to do their work. We had quite a bit of a few questions on how we responded to COVID. We got an 84% agreement that the leadership took appropriate action. We did get some comments that stung a little bit though, because I think some of the comments indicated that it didn't feel like for some staff that we were as prepared as they thought we should be. I could go further, but I mean, you can look at this, and if you have any questions, I'd be happy to answer. I guess trying to interpret what staff mean when they answer these questions is a little tricky, and I think that's where we want to identify areas that we want to delve a little bit more deeper into. Does anybody have any questions?
All right. Let's move on to agenda item number 13, our 2021 public health fee schedule. Should be in your folder under agenda item number 3, or summary number 3.
We still have Rose. Are you able to speak to this, Rose?
Yes, yes. Annually, we have the Health and Human Services Board review and approve our annual public health fee schedule. And upon a review of where we have been over the past 3 to 4 years, the decision was made that we will maintain the very same price schedule as we have had at least since 2019. So we're going to be consistently applying the very same fee schedule to the services that we provide.
Does anyone have any questions about this? A motion would be appropriate then to approve this for the upcoming year.
I'll make that motion.
Motion by Supervisor Glassbrenner. Is there a second?
I second it, Debbie Kaiser.
Seconded by Debbie Kaiser.
I will second.
Is there any further discussion? Hearing no further discussion, all those in favor signify by saying aye.
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 All those opposed say nay. Our fee schedules are approved. Moving on to agenda item number 14, our 2021 Behavioral Health Services fee schedule.
So for this fee schedule, the bottom half from the IDP assessments down, there were no changes except for the addition of the originating site fee. The originating site fee is added. When patients are able to come into the office, we serve as the telehealth site, so we're able to capture that originating site fee from insurances for having patients see our psychiatrist using the telehealth equipment. On the top half, going up the scale, it's a small 1% or so increase just to cover costs, or if you're looking at it going down from psychiatrists to the mental health tech or rehabilitation worker. So those are the changes for the 2021 fee schedule.
I should.
Motion would be appropriate.
I so move. Cindy Chicker.
I can second.
We've got a motion by Cindy Chicker to approve our 2021 mental or behavioral health services fees, and seconded by Supervisor Glassbrenner. Is there any discussion on this? Hearing no discussion, all those in favor signify by saying aye.
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 Those opposed say nay. Motion carried. Let's move on to agenda item number 15. Approve the emergent purchase of soft phones for the ADRC. Roxanne, are you available?
Yep. So the ADRC staff are all working remotely for the most part now, and part of being able to work remote is they needed to have access to their extensions for their phones. And so we had moved everybody back out of the office pretty quickly back in November and needed this to be able to maintain services as we still have staff that are taking calls from all of their clients and so forth. So it wasn't included in our ADRC budget, but we should be able to claim part of it there if it's not covered under COVID expenses.
For the background on this, what is the committee's pleasure?
I move to accept.
Motion by Supervisor Nelson. Is there a second?
I second it.
Seconded by Debbie Kaiser. Is there any further discussion on the emergent purchase of soft phones?
Well, I'm not familiar with what they are. What exactly is a soft phone?
So a soft phone is technology that goes through each individual laptop, and they have a headset. So basically they're forwarding their calls from their office phone to their laptop, and they can answer the phones just like if they were here in the office.
Are there any other questions? Hearing no other questions, all those in favor signify by saying aye.
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 Those opposed say nay.
Aye.
Those opposed say nay. Motion carried. Move on to agenda item number 16, approve the new county positions included in the 2021 budget. And this is postponed from the November meeting that we had.
Correct. We left this on the agenda just because we wanted to keep it there, whether there was feedback from the Finance Committee. You'll recall last month you had asked to postpone this and seek some guidance from the Finance Committee about the best way to bring this forward. So these were those leased positions that we included in our 2021 budget that we want to transfer over into county positions. So it's on here either to allow for some discussion or to take back up again. We did not get feedback from the Finance and Personnel Committee yet. I think the chair was not ready to put it on the agenda. I think there have been 2 Finance Committee meetings since the Health and Human Services Board last met. We're hoping that they will put it on the agenda for the January meeting so that we can just get some guidance from them. But it really, I think what is happening is the chair and our county administrator are kind of going through prioritizing the agenda. And so we're waiting to have this go on. If any of you want to advocate for assuring that it gets on the agenda at the next Finance and Personnel Committee, we'd sure appreciate it.
So these new positions would be the leased employees through Southwest Development
That's correct.
or Workforce Development. Yeah. Okay. Move on to agenda item number 17, approve the Adult Protective Services and Crisis Professional position description.
All right, so I know Miranda's going to speak to this, but before she starts, I just want to share, this was one of the positions on that other item of transferring leased positions to county positions. That agenda item that we had last month was really to approve the job descriptions for all of the positions that we were creating in the for Health and Human Services that came from our budget. This is a new position, and so because there's a delay in transferring those leased positions, this is not a position that's held by anybody. It's not, it was not a leased position. It's just new positions that we had proposed in our 2021 budget. We developed the budget with funding streams to support this because there is a need for the work to address the workload for adult protective services and crisis. So I'm sorry, I might have stole your thunder, Miranda. Is there anything else you'd like to add?
Yeah, I would just say for adult protective services and crisis, there is that overlap, and our crisis services have increased by about 30% over a 5-year period. So it would be very helpful for staff to have this additional staff position. Things wouldn't be shared so much on one person within our unit.
So we heard it back. Do you have anything else to say, Miranda?
No, I was going to ask if there's any questions.
So we heard what the proposal is. What is the committee's wishes? A motion would be appropriate for approval.
I would move it to Finance and Personnel.
Motion by Supervisor Nelson to approve this and move it on to Finance and Personnel. Is there a second?
I second it.
Seconded by Debbie Kaiser. Is there any further discussion? Hearing no further discussion, all those in favor signify by saying aye.
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 Those opposed say nay. Motion carried. And we're gonna move on down to agenda item number 18. This was an addendum to our original agenda item that we have. Number 18 is approve a revision to the Health and Human Services addendum.
Yeah, this is kind of in looking at how recruitments have worked. We recognize that every now and again, if an exception could be made to the requirement for social work staff to be licensed, when we have an otherwise qualified staff, we would be able to recruit and fill a position. It's a really valuable thing for us to have certified and licensed professionals working in these positions. And so we really value having that. And in most cases, that's the desirable thing, is to have certified social workers, certified substance abuse counselors, licensed mental health professionals. But there are times where we have candidates with a 4-year degree. They have experience in the area, and they are qualified in every other sense, but they do not hold the certification. The proposal here is to give some authority for Health and Human Services to waive that certification if it's in the best interest of the agency, and if there is not any other requirement for that job to hold a certification. This is entirely for social work positions, bachelor's degree social worker certified positions, where we would have the authority to waive it as long as that certification wasn't required for the person to do the duties of that job. So that would include the information and assistance specialists in the ADRC, the child and youth case management staff in Child Protective Services. It would include the new mental health case manager positions that we're looking to pass for the 2021 budget. I think that's all of the positions. It would include the APS crisis position, the new position, as well as the existing APS position. So it would include those bachelor's level positions that we require a social work certification for. But in the event we weren't able to recruit someone who had that and was not eligible to receive that, that would allow that person to be hired. They would not advance to that certified social worker level on the pay grade scale. And so there would be a pay differential because we want to make sure that the certification is a valued piece of our staffing. So the request is to allow for an exception to be made.
You heard the presentation. What is the committee's pleasure?
Tracy, is there any change in billing or reimbursement if they don't have the appropriate certification or licensure?
There wouldn't, the billing and certification, there would not be in the ADRC. In the behavioral health unit, I don't believe there would be, because they're billed at their educational level, not at their certification level for bachelor's level social workers.
I would entertain a motion.
I approve it.
I'll
Motion.
second that.
Motion by Debbie Kaiser to approve the addendum to the Health and Human Services handbook. Is there a second by Ingrid Glassbrenner? Any further discussion? Will there be a requirement for them to get their certification?
There currently is. So it's the way it's written now is we can hire someone who does not have a certification, and that's the current expectation, and that's what we would plan for in most cases. This would be allow the exception to be made in an instance where someone really without actually going back and getting a new degree would not be eligible to get certified. The social work certification requires a certain level of coursework and a certain level of experience. And so it would be the rare circumstance where someone couldn't achieve that. Hopefully I'm answering your question. So in most cases, we would expect that to be what happens. What this does is allows us to say in an individual situation, we will make an exception, but they also will not advance on the pay grade to that level.
Are you gonna, is there a requirement that like within 6 months or a year of being hired to get that certification?
Yep, currently the requirement is that they have 2 years because it does take that long to obtain it. So right, that wouldn't change, that's still there. What this does is allows us, for those who just really don't have the capacity to do it because of their current degree, we say we have a person with a bachelor's degree, but they really don't have the right degree in order to get that social work certification. It would allow us to say, okay, we will waive that requirement because you are qualified in every other way.
And do we currently have employees working right now?
We currently have employees who are working toward their certification, and that won't change. One place where this will be initially impacted is there are 1 or 2 of those staff that we would be looking to transition from the lease positions to the county positions who do not hold the degree that would allow them to be eligible for social work certification. So that exception would be made in those 1 or 2 instances. It's really, we want to keep the motivation for staff to obtain that certification so then they would be able to advance up to that other pay grade level. But we would have a couple where I don't think that would be possible for them.
Are there any further discussions? Hearing none, the motion on the floor is to approve the addendum to our Health and Human Services handbook. All those in favor signify by saying aye.
Aye.
Aye. Those opposed say nay.
Aye.
Those opposed say nay. Motion carried. Move on to agenda item number 19, approve utilization of substance abuse block grant prevention funds.
So, oops. That's part of our prevention funds. Every year we get substance abuse block grant funds from DHS, and that's filtered through from SAMHSA at the national level. 20% of those funds have to be utilized for substance abuse prevention services. So early intervention services really to decrease substance use in the community. So far, we've worked on several things, and we've worked with the local school districts and the Partners for Prevention Coalition to try to bring an educational program into the local school districts. In early November, largely because of COVID and just a little different type of school year, we learned that wouldn't likely be happening until 2021. So we've focused our efforts in the last few weeks on carrying out a plan that the Partners for Prevention Coalition has been working on this calendar year. On advertising and website creation to really increase community collaboration to reduce substance use by youth in the county. So what we're asking to do is as the coalition purchases these items, we're asking to pay for those through the fiscal agent for the Partners for Prevention Coalition or the Richland School District. And you can see, Tracy scrolled down to share the action plan. So those things focus on, again, sharing the community assessment about local substance use problems and consequences, working on a 3-person marketing work group, working on the coalition logo and other media campaigns, creating a brochure that can be distributed to individuals in the community, and then gaining that social media presence for the coalition with Facebook, Instagram, Twitter, Google, and TikTok. Purchasing Instagram, Google, and Facebook ads to increase awareness, really focusing on the youth. That's the area that the coalition has found would be most beneficial with youth. Working on job descriptions, and again, then that website development for youth and adults in the community to really decrease substance use by youth. And Betsy Ressler from the coalition worked in collaboration with our unit to get this together. She just couldn't be here today.
What is the committee's wishes? A motion would be in order to approve this
I can
expenditure.
make the motion.
So we got a motion by Supervisor Glassbrenner. Is there a second?
I second it.
Seconded by Debbie Kaiser. Is there any further discussion? Questions? Hearing none. All those in favor signify by saying aye.
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 All those opposed say nay. Motion carried. We're now at our end of our agenda at agenda item number 20. Motion would be appropriate for adjournment. Debbie, would you like to make that motion?
Yes, I do.
Okay.
I move the meeting be adjourned.
Got a motion by Debbie Kaiser to adjourn the meeting and seconded by Mrs. Chicker. All those in favor signify by saying aye.
Aye.
Aye. Those opposed say
Aye.
nay. Motion carried. Thank you everyone for attending today's virtual meeting. Bye.